Welcome, everyone. Thank you so much for joining today's Aligned Modern Health Digital Doc conversation on adrenal fatigue. We are joined by Dr. Ron Bouffard, functional medicine physician, and Dr. Brendan Fegan, licensed acupuncturist, each with Aligned Modern Health. Before we turn it over to our presenters, we'd just like to introduce Aligned Modern Health in case it's your first time joining one of our Digital Doc webinars. Aligned Modern Health is the Midwest's largest integrative medicine provider of alternative medicine. Alternative medicine simply means no drugs, no surgery. We really aim to get to the root cause of why our patients are feeling what they're feeling, and we don't just focus on one siloed symptom or condition. Each of our 18 clinic locations around the greater Chicagoland area are supported by several different services. We feature a physical medicine practice, which is supported by chiropractic care, injury prevention and injury rehabilitation, athletic performance support, and clinical massage therapy. Our acupuncture practice is an amazing practice rooted in traditional Chinese medicine that can be beneficial for physical pain, both acute and chronic, but also some intangibles like stress, anxiety, depression, men's and women's health and hormone balancing, pregnancy and fertility support, gastrointestinal and neurological disorders, seasonal allergies, and a host of other symptoms. This practice is also supported by customized herbal medicine and some other modalities under the traditional Chinese medicine umbrella like cupping, moxibustion, and gua sha. We round out our services both in clinic as well as via telemedicine in several US states with our functional medicine and clinical nutrition practice. This practice is a wonderful way to do a deep dive diagnostically internally to better understand why you feel what you feel externally. We support a variety of gastrointestinal conditions, autoimmune disorders, bloating, constipation, fatigue, migraines, hormone balancing, hormone replacement therapy, food sensitivity testing, and a host of other symptoms that stem often from the gut-brain connection. This practice is also supported by nutritional counseling, as a lot of lifestyle changes and modifications can be tough to navigate on our own. Aligned Modern Health is in network with most major insurance providers, and it would be our pleasure to help you navigate and understand your benefits and coverage. And we also offer free 15-minute consultations, both in clinic or via telemedicine for functional medicine, so that you can ask questions directly to a provider in a private setting. Speaking of questions, we absolutely encourage your questions today here about adrenal fatigue. Please go ahead and type those questions anytime into the Q&A feature of Zoom. This is the little Q&A icon with the 2 conversation bubbles on your Zoom taskbar. We will address questions at the end of the presentation. All of this said, it is now my pleasure to welcome our providers, starting with Dr. Ron Bouffard.
Good afternoon, everybody, and thank you for joining us today for a really interesting conversation on adrenals and adrenal fatigue. As Janine said, I am the functional medicine provider at 3 of our in-city clinics, River North, Wicker Park, and Logan Square. I also do remote consultation through Zoom. I've been a practicing chiropractor for 30 years. It began my delving into a functional medicine about 15 years ago, starting with becoming a diplomate of the American Board of Chiropractic Internists, which is the functional medicine arm of the chiropractic profession. I did my second diplomate in nutrition soon after, and have been practicing since. I've been here in Chicago for the past 5 years. I really enjoy meeting up with lots of people who have pretty interesting and diverse symptoms that aren't always addressed traditionally very well. And I appreciate the fact that Aligned is a very integrated practice with chiropractic, acupuncture, nutrition, diet counseling, and other physical modalities. With that, I'm going to pass this over to Dr. Fegan so he can introduce himself.
Hi, everyone. I'm Dr. Brendan Fegan. I'm one of the acupuncturists here at Aligned Modern Health, NCCAOM board certified acupuncture and traditional Chinese medicine. And really what that means is traditional Chinese medicine is its whole, it's its own medical system, a complete medical system. We have our own diagnostic criteria, our own diagnostic assessments, and treatment programs that are rooted in traditional Chinese medicine, traditional Asian medicine in general. In traditional Chinese medicine, oftentimes we are going to be including the herbal medicine component as well. Not every acupuncturist does herbal medicine, but the herbal medicine is very useful, particularly for any sort of internal issue. So if functional medicine, think of the herbal medicine as the functional medicine equivalent for an acupuncturist. We're working on some of the same type of internal issues that a FM doctor might work on as well. I got my doctorate and master's of acupuncture and traditional Chinese medicine from Bastyr University out in Seattle. And then I also did my undergrad work at Michigan State. And so, yeah, I'll send this back over to Dr. Bouffard, start us off.
Thank you. So the conversation today about adrenal fatigue is quite an interesting one. You know, the adrenal gland, first of all, it is part of the endocrine system, and its function is vast. It definitely affects a lot of other systems. I find it really interesting that in traditional medicine, it's kind of a secondary thought. It's not aggressively really treated. Diagnosed particularly. The gland itself is part of it's called the suprarenal gland because it sits on top of your kidneys. We have them on each side of your body, and what they do is produce a bunch of different hormones. Cortisol is one of them. Many of you recognize it as a stress hormone. Aldosterone, DHEA, estrogen, progesterone, couple of other, these are all these particular hormones that drive very different systems and come from different areas of this particular adrenal gland. When we have adrenal dysfunction, we can either have an accelerated amount of adrenal production or a decelerated amount of adrenal production. And the symptoms vary drastically. But some of the symptoms that you'll recognize from this adrenal fatigue issue, and when we talk about adrenal fatigue, we really are talking about adrenal glands that have been too stimulated for too long, that ultimately kind of just aren't producing enough. Some of the symptoms that we might experience when our adrenals are not functioning appropriately is just generalized body aches. Definitely either a contrast between either anxiety or depression. We definitely can notice a lot of weight changes, either plus or minus. We certainly will see libido changes. We definitely see a lot of immune suppression with sort of adrenals that aren't affected very well. And foggy brain is another, one of the more common symptoms that I think I hear from people. When we are talking about adrenal fatigue, a lot of other people, I think, call this chronic fatigue, and this is when your cortisol levels are extremely low. When that happens, it's usually because you've been under a lot of stress for long periods of time, that your adrenal just cannot keep the output of the cortisol, so the cortisol levels drop dramatically. It'll affect your sleep. It affects your metabolism. It can certainly can be effective of people who have like type 2 diabetes or autoimmune conditions. They're all subsets of some of the same adrenal issues. So when we think about the adrenal and adrenal fatigue, we're kind of listening to the patient, and we can expect there's a lot of opportunities for there to be other things, but because the adrenal gland is such a master gland, my feeling is it really needs to be addressed pretty aggressively, just to make sure that it's the foundation of everything else. And sometimes just by treating the adrenal gland itself, we can certainly make a lot of the changes that I think people are coming in for, the complaints that they have. I say it's time, when we see somebody who has this adrenal fatigue, we find the ways to how to recharge these batteries, because it's kind of what we're doing. That's sort of the general indication of what an adrenal gland is and what it does. Dr. Fegan, can you kind of identify for us what both acupuncture and traditional Chinese medicine, how do you interpret information from a patient and what constitutes adrenal fatigue? Because even though our practices, like you said, are somewhat similar in terms of Chinese medicine and functional medicine, the approach is quite different, and a lot of it can kind of dovetail into one another for sure.
Yeah, they're very compatible with each other. You know, from a Chinese medicine perspective, the adrenal glands aren't really thought of as a separate organ. So whenever we're looking at organs, we're looking at not just the organ itself, but also a lot of times its connections and its functions. So the kidneys are the major organ system in Chinese medicine. They're kind of the root of your health. They even have a psychospiritual function to them, storing the willpower. And any disease, any condition that goes on long enough will impact the kidneys. And if the kidneys are affected, then so will many other parts of the body. Usually when we're talking about the kidneys from a Chinese medicine perspective, we are really referring to adrenal gland function. There are some times where we're going to be looking at like water metabolism, for example, when we're looking at the kidneys. But usually the kidneys are also going to be responsible for like growth and longevity, you know, part of your stress response, the health of your bones, your bone marrow, your brain, sexual function, all these things that would be, you know, involved with the adrenal gland are definitely going to be part of the kidneys. Kidneys, like you said, you know, these are kind of like the battery, or the adrenal glands are kind of the battery. It's the same concept in Chinese medicine that your kidneys are the battery. So if you are experiencing long-term stress, you will kind of steal the energy from the kidneys. The other parts of your body need to use that because they are being blocked or being stagnant. And so they delve into this kind of the stores of energy. You deplete your kidney over time, and then you'll have all sorts of other types of symptoms, from, you know, low back pain, knee pain, you get injured easier, you can't sleep, you know, low immunity, even like dryness, like you see like dry skin, dry eyes, dry hair. There's definitely a big connection with the kidneys and the liver when we're definitely looking at adrenal fatigue. So the liver typically is going to be primarily what is affected first with stress, and then that stress kind of will compound into other ways. The lung can be affected as well. Usually we're looking, the lung is a secondary type of symptom with adrenal fatigue, where you're really having, because the lung is a master of qi. So the lung function gets dysregulated, you'll not have the amount of energy that the body needs. You'll get some neck pain, you'll get some other type of symptoms, some digestive issues sometimes. And then also you can get, because the kidneys and the heart have a relationship as well. So you can get some palpitations, some like rapid heart rate, chest pain, and this kind of thing that have nothing to do with the heart. They're actually a kidney problem. So it's very interesting, you know, the connection that the adrenal gland has. When we're assessing somebody, we're really going to be looking at their symptoms, their pulse, and the tongue. What kind of tests, or what would you look for from a functional medicine perspective?
In functional medicine, I certainly think of a lot. I do a lot of autonomic nerve testing, because you know, the adrenal gland is definitely affected by your autonomic nervous system. So we can see like pupillary reflex is one of the bigger ones that I can see, where I create the stress in the eye, and we should see pupillary constriction, and then we should see dilation. But what sometimes happens with people whose cortisol is super low, the pupil constricts and then doesn't dilate appropriately. We know that that person is under an extreme amount of stress. I also do a couple of different kinds of tests in order to determine how the rest of the body systems are working in terms of balance, and how the body is in space in relationship to where your arm is in space and time, tells us whether or not there's an inflammatory element that's actually creating some brainstem problems, which then downregulates to the adrenal glands. But I start with everybody is doing a comprehensive health intake with them. Spend about an hour kind of reviewing their concerns. And from there, when I hear things like, I go to bed at night, I have either trouble falling asleep or trouble staying asleep, I start thinking right away, is this a cortisol problem? When people tell me they have a lot of anxiety that they just can't seem to control. You mentioned the heart palpitations, excessive sweating, all these things, which we kind of contribute to the idea of that fight or flight mode. We remember cortisol is that fight or flight hormone. So that's an appropriate response at certain times. But what I tell people when it's not being turned off appropriately, it gets stimulated far too much. And now we have this extreme amount of cortisol production. So when I take blood from someone like that, their cortisol is going to be higher than the average of where it should be at that time. That's when really they're in the acute stages of stress. But when I have somebody who's been, long-term acute stress, now when I take their blood, their cortisol levels are way below the level that it should be. And at that point, I'm more concerned with the fact that this has been going on for a very, very long time. And then the only way that a patient can really identify with it as much is really through some of the symptoms. Usually it's that circadian rhythm we try to fix first, because that's going to be the most evident, because other things like libido isn't going to be as recognized to see the changes when we know that when the adrenal gland has really been under a lot of duress. I just want to make sure that everybody understands it is normal for us to have stress. I mean, we stress ourselves out every single day. When the alarm clock goes off, that alarm is ringing, and it's supposed to cause your cortisol to spike. So your body says, hey, time for you to get up, time for you to get going. When we go work out at a gym, we're putting a lot of stressors, lifting weights, causing inflammatory responses to our muscles. Those are stressors. We should be able to rebound from it, but when our adrenals aren't working, we don't do that very well. So I often see people who come in who have extreme adrenal fatigue, who want to do a lot of extreme exercise, and I usually have to talk them off that cliff, because I'm like, you're not really helping. You're just digging that hole deeper. You're adding more stress to a body that isn't really responding to stress. I find that blood isn't the best way to test, because it's really a point in time. If you come in at 9 o'clock in the morning and we draw your blood on a Tuesday and you had a good day, the blood draw is going to probably be okay, unless you drove on the interstate and you were driving aggressively or couldn't find a parking spot, had to run in, all these excitatory elements are going around. Your cortisol could be artificially inflated. So blood isn't the best way to do it. When we really have a tough situation, we usually use a salivary cortisol collection, because we have a number of data points that we can actually collect from through a day. So we'll collect it in the morning and mid-morning and then mid-afternoon and at midnight, and we can see the average range and see how the cortisol is responding throughout the day, giving us a much better presentation of what's really going on. That's how we at least test it. So there's a number of factors involved for sure. It's just a matter of really trying to figure out. I always start with blood first, because that's just easy. We're going to do blood. Let's see what we can find. And if the blood doesn't give me conclusive evidence, then we go into more specialty testing. I find sometimes it's really just a matter of fixing other things, and it's not always necessarily about addressing the adrenal gland directly, because sometimes there are other factors involved: infections, blood sugar dysregulation, et cetera, et cetera. How do you, when you find somebody in your practice that comes in who's super fatigued and has been working out excessively and has low libido, what's your, how do you work through and navigate a presentation like that?
Yeah. So and you made a couple good points there with with the stress and some of the other things you mentioned. So when we see somebody like that, we're going to go through a differential diagnosis, like what organ system is affected or what perhaps channels are affected. So like you mentioned, a little bit like stress is normal, and a little bit is not only is healthy and good for you to have. It's when you have too much of it and for too long of a period of time that you start getting problems. So really what we're going to be looking at is like, what are, the main channels that would be effective. So like the lung, for example. Lung is usually going to be something that is going to be very initial or kind of acute, where somebody has maybe like acute stress, maybe a little bit of a shock or something, they're breathing a little bit different, and then that causes some other types of downstream effects. So maybe they'll have, like if the lung is affected, you may also have some digestive issues. If it's really just the lung, this is a superficial type of pattern that we can then treat a little bit easier. Probably what's more common is going to be the liver. So the liver function is not just the liver, but it's also really your sympathetic nervous system and your parasympathetic nervous system. That balance is very much the liver channel organ system in Chinese medicine. So think of it as, Chinese medicine uses metaphors to describe everything. So think of the body as a city or a town, and it has a bunch of, rivers and streams and things flowing through it. And the major navigation is to go through the channels and the canals of the city. Some of these little canals are going to get filled up with debris and leaves and sticks, and they need to be cleaned out every so often to keep the traffic flowing. That's the liver's job in the body. And in this case, the collaterals are filling up with like emotional debris. So the liver is very easily affected by stress. And if those little collaterals get blocked, then you will have that energy will go other places and you'll have other sorts of issues. If it goes on long enough, you'll definitely have fatigue, particularly, maybe a hard time seeing at night, dizziness, brain fog, things like that. We may also look at what's called Wei Qi. So Wei Qi literally translates as defensive Qi. So this is your immune system. It is also not just the physical immune system, but it extends several feet around your body. So this is also like personal boundaries, for example, or your ability to deal with stress as it comes to you. Now, the Wei Qi is this very kind of an esoteric idea with its root in the kidneys. So it starts in the kidneys, adrenal glands, and then it goes to the digestive system where it's nourished and becomes stronger. Then it goes to the lung where it is then distributed throughout the body, and it lives within certain channels. So one of the things that we might see if there's pathology in those channels is eye problems. For example, like you were mentioning, the pupillary reflex. If it's too closed or too open, those are going to be indicative of the Wei Qi getting stuck in certain areas along that channel. You may also have headaches and dizziness could be part of that. Sleep issues definitely going to be part of that. You can have even like tremors sometimes. I mean, some people who are under a lot of stress will have eye twitches, muscle tremors, things like this, which are harmless, but certainly very disconcerting to a person who's experiencing it. And lastly, sleep is a really big deal. So the liver is very much involved with sleep because the belief is that a part of your spirit resides within the liver. And if the liver isn't well nourished, or if it's too stagnant, if it's too hot, that spirit will be restless. And so you won't get good sleep. People typically are going to wake up 2 a.m., 3 a.m. It's very common whenever somebody comes in my office and says, well, I wake up at 3 a.m. every day. First thing to ask is what's your stress like? Because that's the liver time. That's when the Qi is in the liver. And that's when the people don't get sleep if they're too stressed out about something. So, we would use a lot of different types of treatment modalities to treat this. So for example, easy things would be like mindfulness, or even just like spending time in nature, forest bathing, some herbs, of course. But what kind of stuff does FM? What would you guys do for adrenal fatigue?
Yeah, so I'm actually going to say when people come to us in functional medicine, we also implement several different factors. It's not just about, hey, this is a diagnosis, here's a bunch of pills, we're going to try to fix you that way. We always ask about the sleep. We always ask about your stress. We always ask about your exercise, your hydration, and your bowel activity. All those things that you kind of addressed sort of in a different way are all part of how healthy living can be acquired. And when we don't have balance in our life, that can certainly be affected. And you mentioned about the sympathetic and parasympathetics, understanding that the sympathetics are sort of the activation side of your body, and the parasympathetics are the quiet, rest and relax and repair. And if you're always being stimulated, you're never going to really repair very well. And that's where that whole idea of, if you've got a lot of external stressors coming at you, we do mindfulness and breathing and like you said, grounding and forest bathing is a really great options, because people have to sort of step back and recognize, like, you got to get into that inner conversation with yourself and stop letting the external environment kind of add more to that stress. So we just have to kind of turn off that internal mechanism. And there's so many different ways we can do it without drugs, which is really helpful. I appreciate that side of what you are doing as well, because I think you guys have a much better way of dealing with it at an emotional level as well, because I know that whenever I get acupuncture, I can go in, and some days I just go in and I feel like I'm getting the best nap of my life. And sometimes I go in and I feel like my whole emotional side of me has suddenly broken down. So there's a lot of power in what you can do. Now, in terms of treating, we use adaptogens oftentimes to really try to help correlate and make sure that we're giving it at the right time. But there are also a number of things that, the adrenal needs. It needs vitamin C. It's a really big model for certainly how it's going to be used, and certainly how your immune system is going to address this. I like magnesium, again, a nice calming agent for people who are, having that real issue where their body is so fatigued and stressed because they've been elevated for so long. The magnesium can certainly help with bowel habits. It can help with breathing. There's a lot of things. Oftentimes I'll also even suggest something as simple as like chamomile tea. These are the people who aren't falling asleep at night, who can't get into that restful mode because their body is on that hyper alert. They're still on that acute, that sympathetic dominance. These are some of the things that I like to at least add on until we evaluate, because we really have to look and know what we're seeing. Because as I said earlier, sometimes you've got infection going on, you've got gut dysregulation, you've got other systems that are being involved. It's a lot more than just adrenal, but the adrenal plays a big role underlying it all. But if we don't address all the other arms of this, monster, it's never really going to get better. So we often have to treat, infections, or we have to make sure that from a hormonal perspective, we are nurturing the adrenal gland the way we want to.
Yeah, it's the same with us. It's really kind of like untying a knot. Like finding like, we might have to do a couple loops first, but really the root is something else, right? And a lot of times the kidneys are going to be involved in anything that's really chronic like this. Yeah, we use some pretty similar techniques. Acupuncture is great at reducing stress or the stress response, like especially acutely. A lot of times what we're looking at, because there's very much a perceptual component to acupuncture practice, and it's where your spirit gets involved with it, is like your perception. So it's very good at kind of finding like where is this energy, quote unquote, stuck. Let's move it a little bit. Every time it moves, you're going to feel better after that. In the forest bathing, I like that you mentioned that. It's great. Like I tell everybody, go out into the woods. The trees eat our bad breath, right? They eat our carbon dioxide, and they can eat your negative energy in the same way. So going into the woods and just letting out, you don't even have to do anything. You just kind of have to like psychologically just let those emotions go into the trees, go into the pine trees in particular. They'll be happy to have it, and they'll send you back some positive energy. You'll feel pretty cleansed afterwards. It literally feels like you're taking a bath. It feels pretty nice. And we would use herbal medicine too for a lot of these conditions. So it's really depending on what kind of pattern we'll see. So adaptogens we do use, but we call them more like chi tonics. So something like ginseng, rhodiola, astragalus, these are all adaptogenic herbs that we would be using for somebody with like a chronic fatigue, adrenal fatigue, certain kinds of neurological conditions maybe. We wouldn't use those for every time that we know somebody has adrenal fatigue, because we might need to calm their liver first, in which case the chi tonics might help, like they'll feel better. But if you don't also do the liver moving or liver soothing herbs, then they might feel it won't be as permanent as you would want it to be. So we'll use different kinds of other substances to help soothe the liver. Chamomile, I think you mentioned, really great. Particularly at night. I know chamomile puts me right to sleep. Also helps with digestion. And something we would use is called juhua. It's chrysanthemum flowers. So if you ever go to a store, or nursery, they're selling chrysanthemums all the time. And those flowers, particularly the flower buds, are used often for Chinese tea or in Chinese medicine. Taste pretty good. They are a little bit bitter, a little bit sweet, and they're very calming without being sedating. They also help to cool the liver off, and they have a mild antibacterial function. So those are nice, some nice ways to go about it.
I like when we kind of get to work on patients together, because I do think that we get far better results and quicker results. Because like I said, it's one thing for somebody to come in and say, we know that the adrenal is affected this way. I can give you some adaptogenic herbs. You could give them adaptogenic herbs. My approach again is going to be, let's also look at all the other foundational elements and make sure that if your body does not have enough nutrients dense wise to actually keep a functioning, healthy body going, that's where my focus will be. And then from your side of it, I think what you're saying is that we're also going to help to unravel the liver congestion, so we can get that flow to come through, sort of get the energy, so we're not getting so bound up with all of this external stress that our bodies actually can adapt to it. And that's really the big thing, right? It's the takeaway here is that, like you said earlier, the stress is a normal thing. We have to, I tell people, we have to subject our bodies to stress to be able to accommodate to it. Like we have to subject our bodies to bacteria to be able to, overcome it. So it's a natural pull, ebb, flow, pull, push, however you want to call it. But when we have a dysfunction at this point now, I tell people, now your body's just stuck in the on position all the time. And so you're, riding on the interstate in first gear, you're going to get there, but you're going to really be burning out that engine really hard, So I think when we work together, working with people, we can sort of do a good good 1-2, and sort of get that balance back in a much quicker situation.
Yeah, I agree. In particular with, sometimes we miss things, right? And having another pair of eyes, particularly someone with a different perspective, really helps the patient out. And definitely from my experience, like having someone who can assess the blood results, cortisol results. I mean, these help us make decisions too, right? It helps us kind of find out what kind of pattern is going on. And then also the clinical nutrition side, what kind of nutrients is the person missing? These are stuff that's not super in our wheelhouse. I mean, Chinese medicine nutrition exists, but it doesn't look at the same type of factors. Like it looks at like taste and season and other things. So they're very much complementary to each other. And I think people will definitely get the best of both worlds. They get better results when we work together.
Well, I think we've hit upon most of the topic.
Yeah, I think so.
I'm wondering whether or not we have any questions out there that people might have.
Thank you so much, Dr. Bouffard and Dr. Fegan. This has been incredibly informational and interesting. We do have some questions rolling in. Please go ahead and type any additional questions you have into the Q&A feature of Zoom. Again, that's the little icon with the 2 conversation bubbles labeled Q&A. In the meantime, again, a reminder that you have access to a free 15-minute consultation with Dr. Bouffard, either in clinic in Chicago or via telemedicine, and also Dr. Brendan Fegan at our West Loop Clinic, or any of our providers if you would prefer to ask your questions in a private setting. You may request this free consult by giving us a call at 312-692-6700, or you can visit us online at alignedmodernhealth.com. Starting here with some questions that have been submitted. Dr. Bouffard, in the very beginning of the presentation, you referenced adrenal fatigue often being misdiagnosed or just dismissed completely in traditional Western medicine. Do you have any thoughts as to why, if that's a fair question? And then Dr. Fegan, after, please share your thoughts as well if you'd like.
Yeah, so I think the reason is that the adrenal glands, although a very important gland, there's really not a lot of testing that we do. Cortisol is one of the biggest things. Estrogen and progesterone. There's a couple of other, aldosterone. There's a couple of different hormones. They're just not usually run by primary care physicians. They're usually run by endocrinologists, only at that point where you're not getting results from a primary care doctor for your extreme fatigue. Sometimes it's misdiagnosed as it's a thyroid problem. Sometimes it's misdiagnosed as a sugar dysregulation, too much sugar, too little sugar, because they all have very similar presentations. But everybody who comes in to see me, I always run a cortisol just so I know whether or not I'm working with somebody's body who isn't really ready to adapt to change, because it will make our treatment a little more challenging if the cortisol levels are not appropriately based.
Yeah, I agree with what Dr. Bufar said. I think, in terms of the adrenal function in modern medicine, I think part of it's a measurement issue. How do you measure correctly to know if there is a problem there or not? And then I also think there is just a bit of a disregard in mainstream medicine to quality of life issues, and like adrenal fatigue issues can cause problems long term. But a lot of times when it's initially presenting, it's something people just feel bad. They feel like crap, they feel burnt out, they feel run down. And I think there's a bit of a disregard to that kind of quality of life issues, where it's something that we take more seriously.
Thank you for that. I think that's really important. A lot of times we as individuals know how we're feeling and that it's different or worse than how we usually feel, but sometimes it is hard to explain. And oftentimes it can be very frustrating to feel dismissed by medical professionals. And I'm so grateful to be working with a team like yourselves, where we really listen and understand our patients' concerns and goals and can speak to those. So thank you very much. Dr. Fegan, you had mentioned through liver flow and the channels and the chi that is tied there about needing to cool the liver. Can you explain a little bit more about hot and cold and warming and cooling treatments as it relates to traditional Chinese medicine?
Sure. So when we're talking about liver heat, I mean, there's a lot of things that can cause heat in the liver or heat in a different organ, but we'll just kind of say specifically for the liver here. It's mostly that the liver is trying to pump energy through these collaterals, and it's getting blocked by mental stress, or even it can be a physical problem too. Like if you have a circulation issue, or if your liver is literally scarred, if you have cirrhosis. I mean, these are also going to be problems that cause liver heat. And so that will think of like like a pipe that's about to burst because there's a clog in it. Or like Dr. Bufard was saying, driving on the highway in first gear, like the engine or the gears can overheat. It's the same type of concept or same type of metaphor. Alcohol definitely is going to create more heat in the liver, and that's also why people can't sleep well after drinking, because there's too much heat in the liver as the liver is metabolizing the alcohol. So the spirit, it becomes restless, and they don't get good rest. The way that the conservative ways we would try to cool the liver really is about moving the liver qi. So liver qi moves really well with exercise, with exposure to outdoor green spaces in particular. So a lot of people, like if you see like a lot of professional athletes, martial artists, these are typically people who are very livery, whose liver gets hot easy. And so they kind of self-medicate with exercise. That's a good thing as long as you have the energy and the constitution to do it. Like we had mentioned earlier, if you are already adrenally fatigued, you have low cortisol levels, you have poor nutrition, doing a lot of HIIT classes is going to make you feel worse. Like you might feel really good doing it once, but then if you do it every day, you're gonna kind of break down and be more prone to injury. So exercise is good, but it doesn't have to be a HIIT class. It could simply just be yoga, tai chi, something that's restorative and gets your blood moving and in your breath moving as well, because having good breathing is going to help move the qi in the liver and clear up those the black collaterals in your body.
I love what you said about exercise, Dr. Fegan. We often think of exercise as going to the gym and getting that cardio and lifting the heavy weights and things, but we always say here, movement is medicine. And that's all kinds of movements, right? So like gardening is movement, that's exercise, that's
Absolutely.
medicine. Playing on the floor with your kids or your pets, that's movement as medicine. Parking, at the far end of the lot at the grocery store and getting some extra steps in, or taking the stairs instead of the elevator. Like, this is all movement that our body needs and craves and will keep us, healthy and active. It doesn't always have to be those intense workouts that we kind of think of as exercise. So thank you for
Right.
sharing that. We do have a question for a repeat on the phone number for Aligned Modern Health. I am happy to share that again. Thank you for asking. It is 312-692-6700. You can also visit us online at alignedmodernhealth.com. We do have a question here about adaptogens. I think potentially may have answered that within the presentation after we, initially brought it up and the question came in. But if our friends that have questions about adaptogens specifically, we'll invite you to go ahead and schedule that free consult so you can learn more about them and maybe specific to you and your concerns and goals. A lot of times we try not to speak in universals for folks because everybody is truly an individual, and we don't want to give blanket information out when it comes to specific types of supplements, herbal medicine, and especially dosages. I think that brings us to all the time we have here today for this particular webinar. If we have not addressed your question to your satisfaction, please don't hesitate to go ahead and reach out to us. We are here for you and happy to help. Our last digital doc of the 2024 calendar year is coming up in just a couple weeks. Thursday, November 14th. Is that the right date? Oh gosh, I'm so sorry. It will be yes, Thursday the 14th. Apologies, friends. It will actually be a much lighter topic. It's going to be a fun holiday recipe demonstration. We will be preparing and sharing the recipe and ingredients and procedure for a winter caramelized pear salad with Dr. Buffard, who is here on with us today. Thank you so much for joining us. It is our pleasure to be here for you. You can register for the next and last digital doc of the 2024 calendar at alignedmodernhealth.com. A copy of this recording will be emailed out to all who have registered and will be available on alignedmodernhealth.com to watch on demand as well. Thank you so much. We hope you have a great day. Cheers.